On October 17, we all get to make a very important decision, and that is, do we support the proposed cannabis legalization and control bill? We wanted to get some expert advice from those who have already been down this path and are seeing some of the consequences of legalization. Several states in the USA have already legalized. We know that Canada has done that nationally, but perhaps one of the most famous states to have legalized is Colorado. And so I'm really grateful to be able to talk to an expert from the School of Medicine at the University of Colorado. Professor Christian Thurstone joins me. It's so great to have you with us.
Hello, thank you for inviting me. It's good to be here.
Well, let's go back in the time machine to start today. I want to go back to maybe the first time that it became kind of aware to you that there was this move towards legalization, and you as a medical expert were obviously immediately starting to wonder, what would life be like? Would this be something the medical fraternity support? What were your initial reactions all those years ago to hearing that legalization was on the table?
It's a great question, because starting in 2008, I had a front row seat for this marijuana legalization and commercialization process. So I've been working as a child psychiatrist in an adolescent substance treatment program since 2003. And that's been my full-time job and career, doing research and clinical work in that space. And starting in 2008, 2009, I had young patients come to me and say, "Hey doc, it's okay. I'm taking my marijuana for my anxiety or my depression, because those are very painful conditions." And I started to think, well, wow, this person's in treatment with me for an addiction to marijuana, and yet they have their medical marijuana card and they think they're taking this for their anxiety and depression or other things. And so I started thinking that something just isn't quite right here. And that's when I really started my journey to look into this whole process of legalization and commercialization carefully.
And were you supportive of legalization beforehand?
Well, that's an interesting question, because I used to be a card-carrying member of the Libertarian Party here in the United States, which is supportive of marijuana legalization and legalization of all substances, really. But when I started looking into this and experiencing this with a front row seat, I started seeing that there are some vulnerable populations here whose rights are being violated, in my opinion. So that would be adolescents, children and adolescents, and people who are driving cars and get involved innocently in an accident in which the other driver is impaired from substance use. So I think there's really the issue around cars and kids here that made me think again and think twice.
Well, here in New Zealand, the hope is that by setting the legal age for purchase at 20, this will somehow prevent teenagers from using. And everyone agrees on both sides of the debate that cannabis is dangerous for young people to use. What was the experience in Colorado? Was it the case that young people used less cannabis after legalization?
Well, I published some initial papers showing that about 70% of youth in substance treatment were accessing their marijuana from legalized markets like that. And then we also published that the youth who accessed marijuana from those legal markets had more severe addiction to marijuana than those who were not. And the rationale behind that is that they were accessing a more and more potent product than they used to be accessing. So marijuana used to be about 2 to 3% THC by weight. And with the commercialization and legalization of that product, it's become more and more potent to try to really develop more and more addiction around that.
Well, in terms, though, of sort of total use in that cohort, it does seem from the stats that legal states have higher teenage usage than the non-legal states in the USA. Has that been the experience of Colorado?
So that's a great question. So states in which marijuana is legal either for recreational or medical purposes have higher rates of adolescent marijuana use than states that do not have such programs. And but it's an interesting question, because is that a chicken or the egg, or do those states have higher use, and is that why they legalized the product in the first place? But having said that, in Colorado, I published a paper soon after marijuana legalization showing that the perceived harmfulness of marijuana among teenagers has really gone down significantly. So it used to be back in 2008 or so that 50+% of adolescents thought that using marijuana regularly posed great harm to them. Now it's down to about 30%. So that perceived harmfulness has really plummeted significantly. Then we see one survey, which is a community survey, showing significant increases in marijuana use over the past decade or so in Colorado among young people. And no one doubts at all that there's been a very significant increase in marijuana use in that 18 to 25 year age range, where we know we still have the developing brain, and which is a really important time for social development. That's when people are developing their relationships, finding their spouses, developing their careers, and that's a very important time frame at all. And that's really skyrocketed to about 1/3 of that age range, 18 to 25-year-olds use marijuana in the last month, and it used to be about 20% or so. Now, there's one other thing to mention is that we're clearly seeing in all of our studies an increase in the amount of use of highly potent products. And so using marijuana wax or dabbing marijuana has gone up very significantly. So now out of about all of the adolescents who use marijuana in the last month in the state, 50% of them used very highly potent products, as well as vaping. Marijuana has gone up about 60% in just the last couple years. So we're seeing some significant concerning trends among adolescents in the state.
Well, let's talk about potency. There are a couple of questions I have around it. One is around this idea that when legalization occurs and there's a whole variety of products available, that people might choose to have the low THC products. In fact, it was mentioned in a debate just last night that it was a bit like choosing to have a peppermint tea before bed to choose the sort of low THC product. And yet we're aware that there's these incredibly high THC products are in the market. Now, they won't be part of our legal stores, but is it really true that people choose low THC products, or is this part of the addiction cycle, is the desire for stronger and stronger product?
I think that's a great question. So the data don't support that people are using more and more of just the low potency products. In fact, it's quite the opposite. People have been seeking higher potency products or using more highly potent products. On the one hand, it makes no business sense for a company that's trying to make money to produce a low potent product. We know from our experience with big tobacco that the nicotine content of cigarettes went up significantly over time. And similarly in the United States, what we're seeing is that the THC content of marijuana is going up, and that's the addictive part of the plant. And the CBD content of the plant that's typically being sold is going down. And CBD may actually counteract some of the addictive potential of marijuana. So that's just not been our experience where people are using these low potency products.
Well, let's talk about what is high and what is low. We know as soon as you say that an edible product has 60, 70, 90% THC, that must be bad. Our law is saying that the legal stores will only sell products up to 15%, which sounds relatively low by comparison. Is 15% low THC?
Well, I think that's a great point, because back in the 60s, 70s, 80s, 90s, marijuana was about 2 to 3% THC by weight. So even if there's a product that's being sold at 15% THC by weight, that's still 7-8 times more potent than what people might remember using in their youth.
So in terms of the effects, though, what might be the difference of having even a 15% THC? What might be some of the mental health responses to a relatively strong product?
Yeah, that's a great point. So basically the intoxication is more severe. And we've seen a lot of cases of cannabis-induced psychosis, cannabis-induced panic attacks in our ER. And these aren't just a case here and there. I was attending on our inpatient unit recently and saw multiple cases daily of cannabis-induced psychosis among teenagers. And our ERs see this every day now in terms of psychosis, a break with reality, in the context of heavy marijuana use and heavy intoxication of marijuana. So those are very real issues that we see on a daily basis now in the healthcare field.
Can you play out what psychosis looks like? I mean, if a young person came into the ER and it was determined they were having psychosis, what sorts of things would they be saying about the experience they were having?
Yeah, so psychosis includes some kind of break with reality in terms of seeing things that are not there, hearing things that are not there. I had a patient just last week who was talking about being followed by the police and that his friends were listening into various conversations that he had. So a lot of it can be paranoia like that. That is a very real thing in terms of marijuana, especially at 15% or above. Concentration can cause during intoxication psychosis. There's no doubt about that. Then very interestingly, since 1989 was the first study that came out showing that adolescent exposure to marijuana predicts adult onset psychosis and schizophrenia, about a 2 to 4-fold increased risk. That is a very real finding that's been duplicated about 10 times in various samples from all around the world. And it's been shown to be very real that adolescent exposure to marijuana significantly predicts psychosis and schizophrenia in adulthood.
All right, I need to know what exposure means, because I often hear, oh, yeah, well, those are only young people who become really heavy users all day, every day. Do you have to smoke that much to trigger that kind of response?
I think that's a great question, because my young patients ask me all the time, but doc, how much can I smoke and get away with? And so the bottom line is there's no known safe amount of marijuana use in adolescence. No known safe amount of marijuana use in adolescence. The increased risk starts with any exposure, and we know that it's dose dependent, so that the more marijuana adolescents are exposed to, the greater the risk they have. It's also good news too. It's never too late to stop and change one's risk and exposure.
Let's go to the other part of the story, because oftentimes we're hearing, well, young people are young people, and this is about protecting the vast majority of adult users who really can use cannabis very safely. And it's almost presented as if there are two types of cannabis, the one that triggers psychosis in teenagers and the one that triggers sleepiness in adults and nothing else. Is it really true that once you're over 25, the risks disappear?
The risks don't disappear completely, but they do go down significantly. So, for example, in adolescence, if somebody uses marijuana before the age of 18, the risk of developing what we call in medicine cannabis use disorder, which basically is marijuana addiction, is about 1 in 6. If somebody begins using marijuana after the age of 18, the risk drops to about 1 in 11. So there's much less risk of developing an addiction, but there still is risk, is the flip side of that story. I think another issue is that anytime somebody's intoxicated with something, then there's risk involved in terms of driving, making poor decisions, taking care of children, handling emergencies, things like that. Whether it's intoxication of any substance, there's increased risk.
Right. So if we broaden in the adult cohort, the risks, not just medical or mental health risks, but now include social and relational and employment risks, suddenly we notice that actually bad things do happen to adult users, just maybe not so much the paranoia and schizophrenia part.
Right. Especially with the more potent products, and 15% is a potent product. Adults can have very adverse experiences even with that in terms of developing paranoia and addiction. And I think driving is, as I mentioned, cars and kids. Cars, if anybody drives under the influence of marijuana, that's a huge public health risk right there. People laugh and joke that marijuana makes them drive more carefully or more slowly, but it's just not true. We published one paper showing a significant increase in the proportion of traffic fatalities in which the driver tested positive for marijuana. And there are very nice studies from France and other parts of the world showing that marijuana impairs driving abilities related to being able to pay attention to what's in the rear view mirror, side view mirror, odometer, speedometer, everything all at once. And it also impairs timing, judgment, coordination. All those things are clearly impaired in marijuana intoxication. And one of the issues we've had here in Colorado is once marijuana was legal, how stoned is too stoned to drive? And where do you make that cutoff? And we still haven't figured that out yet here in Colorado, even though we're, more than a decade into this, if you count 2009 as our year of really commercializing marijuana.
Well, in terms of that, you have more trend data than perhaps Canada, only legal for a year, still kind of working out what happens. It's been suggested that there's a bit of a honeymoon period after legalization where some people think, oh, well, I'll try it, but and so there's a sort of a bell curve of new people trying it for a little while, but then things settle back to sort of pre-legalization numbers. Was that the experience of Colorado? I mean, you've got 10 years. Are there more people using cannabis now than ever?
That's a good point. I don't think we've seen the back to baseline yet. If anything, to me, it feels like a snowball that gets bigger and bigger and bigger as it rolls downhill. The marijuana industry gets more and more powerful as time goes on. So, for example, in the year after we had marijuana commercialization in Colorado, this is 2009, we saw a 40% increase in the number of school suspensions and expulsions for marijuana use. That has not gone back to normal yet. I don't know, that just hasn't been our experience yet in Colorado where things trickle back to normal.
Okay, so 10 years in, there were all these hopes that legalization would reduce harm in some way, that things would be better if it was legal, brought out of the black market and into the light. Has it proven to be true? Are people satisfied with the results, or is there now a kind of a sense that, boy, we made the wrong call here?
I mean, I think it depends on whom you ask. So people who are involved in the marijuana industry and are making a lot of money, I think might think this is wonderful. And all the people who are peripheral to that think this might be wonderful. But I think that if you are a physician who works with children, a physician who works with emergency situations, if you work in a school, something like that on a real frontline level, you tend to see more of the harms and risks. If you're a parent, I think you also see some more of the risks in terms of the benefits.
So in terms of what New Zealand is facing, and we have a more conservative law, there's no doubt that what's being proposed is more conservative than Colorado. Does the fact that it's more conservative make enough of a difference now that you have all this experience of what can happen after legalization? Is it enough that we're more conservative?
Well, I think there are extremes here. There's extremes in terms of absolute prohibition and locking people up, incarcerating people for simple possession of marijuana. And there's the extreme of outright legalization of marijuana. And truthfully, I think there's a third way approach to this. We don't have to have either of those extremes. So I would still have concerns about the extreme of legalizing marijuana. I think 15% is still rather potent. I think it still will be very confusing as to who is okay with who is legal to have marijuana and who's not legal to have marijuana, and what marijuana grow operations are legal and what are not legal, and preventing the leakage of it, I think is very concerning. I think also the driving issue is a huge issue. Where are you going to draw the line in terms of how stoned is too stoned to drive, and how are you going to measure how people are intoxicated with marijuana? Those are some of the issues that I think should be solved before people even start to think about legalizing and going down that road. Our experience is that once marijuana is legal, capitalism is just a very powerful force. The business forces are very powerful to then produce a snowball effect.
And on that note, the business grows, the legal business. Did you see the black market disappear?
No, the black market has definitely not disappeared. So that's what my patients tell me. That's what we still read in the newspapers, that the black market has not disappeared. The tax money that everybody was hoping for has not been on the level of what we were hoping for. We know that alcohol, tobacco, taxes pay for about 1/10 of their actual social cost. So alcohol and tobacco taxes pay for 1/10 of their actual social costs. So it's not at all clear that marijuana would be any different than that. So anyway, so those are some of the concerns.
Well, we started today by looking back to the time before legalization. You've got 10 years under your belt. Looking forward now, another 10 years, what do you see the future holds for Colorado if it continues on this trajectory?
You know, that's such a good question. History tends to move in pendulum swings. And so in the 1960s, 1970s, marijuana use reached an all-time high in the United States. And then the pendulum swung the other way. And then now it feels like it's swung the other way back towards high rates of use. And so, you know, my prediction is we'll probably go back the other way when it becomes, you know, it took 70, 80 years for us to push back significantly on big tobacco. So I think it'll be a similar amount of time in terms of pushing back on big marijuana. And but the truth always does come out, I think, and the science will always come out. And hopefully we'll land somewhere in the middle, neither of the extremes, but somewhere in the middle, very rational, science-based approach to marijuana policy.
And just to be clear, you're predicting that some of that swing or that correction is because the culture, the society will become more aware of the real risks and the real consequences, and suddenly the normalization will be sort of pushed back against, and hopefully people will begin to remember, actually, this is a harmful thing to do.
Right. The data are becoming so clear on the association between marijuana use and psychosis. The data are already very clear. There's a strong relationship between marijuana use and school failure, school non-completion, dropping out. And then the data are very clear so far in terms of marijuana use and driving under the influence and the public harms related to that. So I think it's a matter of time before those kinds of stories make it out. And we'll need a combination, I think, of science as well as stories. I think that's what really sways people's opinion around things.
Well, we very much appreciate your expert contribution to this conversation. It's important information because we are forced, of course, to try and look behind, or look ahead rather, this kind of fork in the road and think what's ahead of us. You've helped us see that some of what's ahead might not be the place we want to go. So, Professor Christian Thurstone, thank you so much for your time today.
Sure, I wish New Zealand lots of luck in their decision making, and thanks for having me on.